Hello everyone. Let us now start about the Amavata, that is rheumatoid arthritis. A means near, near to or towards, the one which is nearer. Ma means here the poison. The product which is nearer or which is near to the poison or act like a poison is ama. So how we can consider it as a ama? Mainly, the ama is mainly we have studied it in the first year that Ushmano alpa balvatvena dhatu adyam apajitam dushtam amashayagatam rasamamam pratyakshmahe. So this is the shloka from the Ashtanga Hridaya. So we have been studied that the adya dhatu, the improper digestion or the indigestion of the adya dhatu, that is the rasa dhatu, leads to the manifestation or the production of the ama, which is considered to be as the toxin is present in our body. So this toxin will circulate all over the body due to the flow or the influence of the vata, and it gets stagnant over other parts of the body, or it gets stagnant over the joints, mainly major joints of the body. Then it will lead to the production of the amavata. So let's see. Is the nirukti of amavata here is amyate, gamyate, pachayate iti. So here mainly the ama dosha. So ama which is present in the koshta, it is circulated because of the nidana, some of the nidanas which are responsible for the circulation of this ama with the influence of vata all over the body, and it gets settled there. It get sthana samshaya of these doshas in the major joints of the body. So it will leads to the manifestation of the disease called as amavata. Let us have a look at the nidana of amavata. अत आमवातनिधानं विरुद्धहारचेष्टस्य मन्दाग्नेर्निश्चलस्य च स्निग्धं भुक्तावतो ह्य अन्नं व्यायामं कुर्वतस्तथा. So, what does it means? Mainly, we can divide this nidhana into aharaja and viharaja nidhana. So, viruddhahara chestasya, here we can consider that the person who is regularly indulging in the viruddhahara sevana, so the foods which are not wholesome to their body, so if they are taking that, so followed with this, soon he or she indulges in forbidden physical activities. So what we can consider here mainly viruddha ahara achestasya. So mainly it is combination of both ahara and viharaja nidhana which will lead to the manifestation of mandagni. So what does we see here is viruddha ahara achestasya mandagni nishchalasya cha. Here the person does the intake of the viruddha ahara, followed by he is not going to do any of the physical activities. He will be always uh, taking the food, and he will be only always on the bed, or he is taking rest. He is always lazy and not doing any work, any physical work after the intake of the viruddhahara. So that will leads to the manifestation of mandagni. So that's what we can consider here as viruddhahara achestasya mandagni nishchalasya cha. So the person after the intake of viruddhahara, so after the intake of the viruddhahara, here we can consider here two contexts. We can split it into two contexts. This shloka can be splitted or understand in the two contexts. How we can understand here is mainly viruddhahara achestasya mandagne nishchalasya cha. So here mainly viruddhahara, you can consider that the person is taking regularly the viruddhahara, the food which is not wholesome to them. Like by the example we can say here is that the person is taking this curd with the fish. So immediately after the intake of the fish, if the person is taking curd, and if the person is taking milk products with the fish, and milk products with the milk and milk products with the non-veg, is taking the honey and ghee in equal quantity, then it is also one of the reason for the manifestation of many of the skin diseases. And if the person is taking oily food items, or a person is taking the heavy fried and the deep fried items are taken by the patient regularly on the regular basis, and the fish and seafoods are taken in the excessive amount or quantity, and along with that they are taking it the heavy food items like the curd and milk products are taken together, and the sprouts are taken with the milk, so it is also considered as a viruddha. So these are the things which are important. And nowadays mixing of the food is so much like that, the every person in their life they are having the minimum to maximum of viruddhahara intake in their lifetime. So that's why it's better to avoid the foods which are prepared in the bakeries, or the maida prepared foods. They're also heavy for digestion. They will lead to the formation of this ama. So these are the, these are all are the examples for the this virudahara which is taken by the individual, and some people are having the habit of taking the cold drinks in an empty stomach. So this is also leads to the manifestation of ama, because the cold drinks are very acidic, or we can consider they are having the acidic nature, so they will go into the stomach. If they are taking it in the empty stomach, then it will leads to the neutralization of the acid, and it further does the agnimandya, it will leads to the production of the ama. So it is also main thing, these are the main things which should be avoided by the patient or the person in their daily routine. It will leads to the production of the ama. So ama itself is main cause for manifestation of many of the diseases in the ayurveda. So better take care of your health. So it is important. Next we are snigdam bhuktavato hya annam vyayamam kurvatastata. On the other hand, we can consider here that if the person has a sedentary lifestyle and always consumes oily food, soon follows with physical exertion, then such individual soon follows with a physical exertion, then such individual will have the tendency to suffer from Amavata. So here, how we can consider that snigdam bhuktavato ya annam vyayamam kurvatastata. The person he is having the sedentary lifestyle. That we have to understand that main nidana for the Amavata as well as Vatarakta here is the sedentary lifestyle. The person is in his luxurious life or sedentary lifestyle, not doing any of the external activities and not giving any much more stress to their brain as well as to their mental activity. So it is not that much strainful for them. They are always in their luxurious and happy and enjoying nature of the person is there. So snigdam bhuktavato, snigdam here is the person who is taking the always the oily food items. So you can consider here as the oily food items as well as the heavy food items, and sweet preparation we can consider here, because they are snigdha in nature, they produces kledata in the body. So because of that snigdata, because of that kledata, because of that kledata, that is moistness, it is taking much more time for the digestion. So as it takes much more time for the digestion of the food, so it is in the state of ama only. So undigested food is in the state of ama only. So it stays in the body for longer duration of time. So that is also important. Here the special nidhana for the manifestation of amavata has been explained by Harita in his Harita Samhita, that is kandamula sevana. As explained in Harita are pindashaka, surana, palandu, alu, tanbula, Runakanda, Hastikanda, Varahakanda, which are heavy to digest and having Guru Snikta and Mandagunas, leading to the impairment of Agni and formation of Ama. So this is mainly responsible. Vayuna Predito Ya Amaha Slekshmasthanam Pradhavati. The first line says that the Prakopita Vata gets Prakopita by the Nidana has said earlier that Vyayama and Viruddha Chesta, which is responsible for the Prakopa of the Vata, which takes the Ama from Slekshmasthana. Okay, so Ama has been developed in the Slekshmasthana, because in Amashaya, Ama is going to be produced. So the sthana of Kapha is the Amashaya. So from Slekshmasthana, it takes the Ama. Tena Tena Atyaktam Vidagdho Asau Dhamanihi Pratipadyate. So the Ama Pratipadyata takes place in the Dhamani. So Vidagdha here is mainly the slow process or slow circulation of this Ama to in the Dhamanis. Vatapitta kafair bhuyo dushitaha sa annajo rasaha. So the dushita ama, which will due to dosha dushti along with annarasa. So prabhuta dushti of ama takes place. First of all, the ama has been manifested. Along with that, the prabhuta dushti of ama takes place due to the dosha dushti along with the annaja rasa. So srotamsi abhishandayati. Srotamsi abhishandayati here is that due to its stickiness, due to its pichilata, so because of the ama is having its own guna like pichilata, so it get sticks to the strotasis. So you have to consider here stroto abhishandata, because of the stickiness or the pralepa or lepana of this ama at the walls of the strotus, inner walls of the strotus, will leads to the stroto abhishandata, and thus so this ama attains nana varna and atipichilata. So because it is being adhered to the walls of the strotuses, it attains different color, and it also attains atipichilata, means it itself is a pichila, And because it is adhered to the walls of the srotasis, it becomes atipichala. The stickiness of this is going to be increased. Janayatyashu daurbhalyam gauravam hridayasya cha. That will leads to the production of daurbalya and guruta in the hridaya. So the pain we cannot consider pain because the circulation towards the heart and circulation towards the heart is going to be reduced because of the liptata in the srotas or sroto abhishandata. So the circulation towards the heart is going to be reduced. Because of that, it will leads to the production of daurbalyata and gauravata, heaviness in the heart, because the heart has to do more work or pump more to to enhance or to increase the circulation to other parts of the body. And it also produces daurbalyata. Because of its excessive working of the heart, it makes the heart weak. Because it works excessively, then it's normal. Vyadi namashayo hya esha amasanyo atidaranaha. So this vyadi, which is situated in the amashaya, so it is considered as ama, and this is atidarana, which is very difficult to treat. Yugapat kupita was trikasandhi praveshakau. So this ama we can hear, like, the clinical interpretation of this amavata is mainly important because the ama itself is cause for many diseases. So you can consider the ama is responsible for the production of hypertension. How? Because hypertension is also one of the reason for this, because ama is responsible here, and ama does the avroda or avarna of ama to the vata is main cause we can consider here. But here the ama is also one of the main thing which is responsible for atherosclerosis we can consider here. But here on this concept, in case of amavata, we are only concentrating on the amavata, which is related, specifically related to the joints. So let's see the main special feature or specific feature you can understand this is amavata as yugapat kupita once trikasandhi praveshako. Because of the prakopa of vata, the person is having the nidhana for 100 for years together. You can consider the person is having the nidhana of ama. So person is having ama and he is taking regularly the nidana for the production of ama since 10 years, since 15 years, since 16 years, since 30 years. So many of the women is having the complaint of this amavata. Almost all, most of the patients who are women, who are ladies, are suffering from this amavata because of their food, because of their lifestyle. So afterwards, this ama is there in their body for the period of 10 years, 15 years, 20 years. After that, after some time, due to the prakopa of vata, so you can consider it the normal physiological function. So here, during their younger period, during their yavanavastha, they are not having that much of vata prakopa, so they are not going to feel anything here. But ama is there in their olden life, or when they became older and older, in their when they become older, so the vata prakopa is going to be increased. So because of that vata prakopa, the ama which is present in the amashaya, it gets circulated all over the body and it get resided in the trikasandhis. So trikasandhi here is mainly the joining of the three bones which will lead to the production of one joint. So here mainly trikasandhi you can consider here is the knee joint, ankle joint, elbow joint, wrist joint. Okay, we can consider here. So many other joints can also be considered, which is having the combinations of three bones mainly. So the person is having these type of manifestation, and it is also seen in case of smaller joints also. The pain is present in all the joints, but mainly in the trikasandhis. Okay, next, stabda cha kuruto gatra mamavata cha uchate. Stabdam. Stabdam here is mainly the person is feeling the stiffness. The stiffness is so much that he or she can't able to move their hand. Okay, they can't able to do their easy hand movements or normal hand movements during their daily routine activities. It is not possible for them when they are suffering from amavata. Let us have a look at the Samana Lakshana of Amavata. Angamardo Aruchis Trishna, Alasyam Gauravam Jwaraha, Apakaha Shunata, Anganam Amavatasya Lakshanam. So Angamarda. Angamarda here is mainly patient complaints of pain all over the body. The patient is complaining about the pain all over the body. Aruchis Trishna. Aruchi here is a loss of taste because of the ama, and the person who is having ama, it is she or he is suffering from mandagni. Because of mandagni, he is not having any interest to take food, or also he or she is not having any taste towards the food. Okay, Trishna, increased thirst. Okay, Alasyam, Alasyam, the patient becomes lethargic. The patient itself is having the lifestyle of sedentary lifestyle. Because of the ama, the patient becomes lethargic only. Gauravam, the patient feels heaviness all over the body. Jvara, the patient suffer from fever. And because jvara is mainly manifested due to the ama. Here ama is the main symptom, which is this main cause. Here ama is main cause, which is manifestation of all these symptoms, so we can consider it as ama. Apaka, so apaka here is loss of digestion. The person is not going to have proper food intake, and the food which is taken by the person is not digested properly. Okay. Shunata anganam. So swelling in all over the body parts. Amavatasya lakshanam. Shunata anganam amavatasya lakshanam. Let's have a look at the Vishesha Lakshanas of this Amavata. Pittat sadaharagam cha sashulam pavananugam stimitam guru kandum cha kafadushtam tamadishet. So, the Amavata of Pitta predominance, Pittat sadaharagam. So, if it is a Pitta predominant, it is associated with the Daha and Raga, that is burning sensation and redness along with the pain. Sashulam pavanatmakam. If it is associated with the Vata, the main predominant symptom is the pain, Shula. Stimitam guru kandumcha kafadushtam tamadishet. If it is having the predominance of kafadosha, it is having stimidata, that is the symptoms of rigidity, guruta, heaviness, kandu, itching of the affected joints is present. So these predominance of these doshas are helpful for the deciding the drugs or selection of the drugs for the management of these diseases. साध्यासाधिता एकदोषानुगो एकदोषानुगः साध्यो द्विदोषो याप्य उच्यते सर्वदेह चरः शोथ सकृच्र सन्निपातिकः. So Amavata, because of the presence of Ekadosha, it is Sadhya. If it is due to the Dvidosha, it is Yapya. If it is having the Sarvadeha Charaha Shota, Kritra Sannipatike, if it is the swelling has been spreaded to the all over the body, entire body, and also if it is derived or originated from Sannipataja doshas or involvement of Sannipataja dosha, then it is difficult to treat. What is the Prakupita Amavata Lakshana? Mainly, Sakashtaha Sarvaroganam Yeda Prakupito Bhavet. So it is very painful condition, it is very troublesome condition to the patient when the Amavata is in its Prakupita Avastha. So what are the symptoms? What are the symptoms we are going to see in case of this Prakupita Amavata is Hastapada Shiragulfa Trikajanu Uru Sandishu. Okay, so it produces the Karoti Sarujham Shotam Yatra Doshaha Prapadyate. So it produces the Ruja, pain, Shotha, swelling or swelling. Okay, Karoti Sarujham Yatra Doshaha Prapadyate. When dosha which goes to these areas, the Prakopita dosha along with Ama, when it goes to these areas like Hasta, Pada, Shira, Gulfa, so we can consider here as hasta as hands, joints of hands, pada as the joints of leg, shira. It is mainly in the head. You can consider head, rather considering head, it is at the neck region, at the joints of neck. You can consider, okay, gulfa. Here mainly ankle joint. Trika sandhi is mainly sacroiliac region. Sacroiliac region is considered janu. It is in the knee joint. Okay, so all these areas it is going to produce mainly ruja and shota, that is severe painful condition to the patient and swelling in these areas. Okay, the characteristic of pain is mainly is explained very beautifully that sadesho rujate atyartam vyavidda iva rushtikaihi. So the affected area, whenever the ama moves in that place, there will be severe pain as if it is bitten by the scorpion. Vyavidha is bitten by. Rujyate atyartam is the pain over that area. Vyavidya, Vyavidha. Vyavidha matlab it is cutted or bitten by Rustika. Rustika here is the scorpion. जनयेत् स जनयेत् so agni daurbalya praseka aruchi gauravam. It will does the agni daurbalya. There is a loss of digestion due to agni mandya. Praseka excessive salivation is present. Gauravam is the excessive salivation. Praseka aruchi. Aruchi here we can consider that the loss of taste and loss of appetite, and gauravam is heaviness in the body. Utsahahani, decreased enthusiasm due to pain and stiffness. Okay. Vairasyam, loss of here the aruchi is a loss of taste. Vairasyam here is a tastelessness. Tastelessness. Daham, burning sensation. Cha bahumutratam. Bahumutratam, the person suffers from excessive urination. Kukshav katinata, the heaviness or we can consider hardness, and shula. Katinata and shulam. Pain, pain as well as the hardness in the kukshi, in the region of stomach or amashaya. Nitra viparyayam. So disturbed sleep or loss of sleep because of the pain which aggravates mainly which starts aggravating in the from midnight or from early in the morning from 4 to 4 o'clock or to 5 o'clock. It is going to be increases so much. The severity of the pain is very much that the person is not able to sleep and the patient can't able to tolerate that pain. So that is called as nidra viparyayam. Throat charthi. Throat charthi brahma muchasta rudgraham vit vibhadatam. So increased thirst is present. Throat and chardhi, vomiting, brahma giddiness. Patient is associated with the brahma giddiness and mucha loss of consciousness sometime. Vrut graha, pain in the chest region, and person suffer from the vibhadatam. With vibhadatam here is constipation. Jadya Jadyam mantrakujam manaham. So there is a decrease because it is not having any food, or the food which is there which is not properly digested. Because of that, the decrease in the function of that pakvashaya. But the sound due to the production of gas and any gas and other things, it is going to increase in the sounds in the bowel. Next, because of that, there is a abdominal distension, that is anaha. Kashtamsha anya upadravan. So it is also associated with the severe difficulties and complications.